So I'd like to welcome Kara Flannigan, one of Algoma Public Health Inspectors, to Sue Online. Kara, we're here at the 50th anniversary. Can you talk to me about the relevance of public health and specifically what it is that you do in regards to public health and safety?
Well, welcome to our
Thank
50th
you.
anniversary.
It's exciting.
Yes, in 1968 we started, and a small group of people realized that we needed a board of health to make decisions so that our health was safeguarded going forward in the city of Sault Ste. Marie. And now we cover the entire district of Algoma, and
Yes.
that's over 125,000 people that we try to optimize their health and help them make healthier choices.
Sure.
In environmental health, we do such a wide variety of things.
Okay.
Across the agency, I'm never bored with all of the exciting things that we do that people aren't aware of. We look after sexual health, dental health,
Yes.
nutrition, healthy children, slips, trips, and falls, nutrition programs. We're in the schools, and in environmental health, and of course we have public health nurses and dental health educators and mental health and alcohol and drug counselors.
Sure.
The variety of programs that we offer to the community. Please come on down, get your flu shot while you're here, and we're open today. So welcome to environmental health, and we do such a variety of programs to protect people from the environment, for safe water, for safe food, for recreational waters, beaches and pools. We do health hazards like radon. Come on and get a radon test kit and test your home. We do personal service settings so that you don't get infectious diseases or injuries from getting a tattoo or in beauty services. We do Smoke-Free Ontario so that you're not exposed to secondhand smoke. We do emergency planning in the event that there's flash flooding or a fire or another emergency. We're big on infection control in healthcare settings, in nursing homes and daycares. We also follow up on animal bites to ensure that people aren't exposed to rabies at the time of the bite from pets or wild animals. And of course, we are the food police. We go in and do inspections in food premises to enforce the regulations, to encourage better practices for safe food handling. We're involved in recalls. You might have heard about the romaine lettuce issue that's been a problem in our community. So we try to make sure that when you're out, your water is safe to drink, your food is safe to eat, and you're not exposed to any safety or health hazards.
And your website takes you, there's different links on your website that help to take you to other places for further research. Now, when you do the food inspections, do you post those results to the website?
Yes. Currently we have disclosure, so when we go to do inspections of the pools, the personal service settings, and food, the non-compliant items are indicated on our website, algomapublichealth.com, under food safety and recreational waters and personal services.
And the radon kits you mentioned, are those free for people to come pick up?
Please
right on.
Come down, and radon is an invisible and there's no odor, no indication of radon being a problem. And so we encourage people to test their homes. We have test kits available here. You can come on down, get a test kit.
That's fantastic.
We'd like you to fill out a form so that we know where we're testing. And please take a kit. You set it up in your home for 3 months, and then you mail it away, and then they will mail the results. And so if you have a problem with radon in your home, you can take action and do remediation to bring the levels down to a safe level.
Right. And is it the basement that you want to put the radon test kit?
Well, if there's no hanging around in your basement, you don't want to test your basement. But that is the point where most of the radon would enter your home if you do have a basement. However, it's better to follow the instructions on the kit and set it up in an area where you spend most of your time.
Okay. Perfect. All right. Thank you. Now, can you talk to me about about water? Like, I know that water is a fundamental necessity that we all have. And what are some of the things that you do in the community to protect water resources?
Well, all of our inspectors are trained for a small drinking water system. So
Okay.
any place that you would go where you have access to a small drinking water system, that we make sure that the system is operating in compliance with the regulations, and that the operator is taking samples to prove that the water
Right.
is safe. We also have a lot of people in our community who have their own personal water supply
Right.
in their well.
Yeah.
So we encourage them to take a water sample at least
Okay.
4 times a year when the
Okay.
change of season.
Right.
And more often if your well is vulnerable to
Runoff.
contamination.
Right.
So public health is different than publicly funded health care.
Right.
And the physicians and doctors and hospitals do a wonderful job treating people that are sick. But the role of public health is to try and make the community healthier, or to maintain the health that they have and prevent them from getting sick. So we have a number of activities that we engage in, from keeping your food safe in restaurants,
Right.
to trying to get you to reduce smoking, to trying to
Right.
get you to be more active, to eat healthier, to drink less, and a variety of things like that.
Right. And so you've come to the community in the last year or so, isn't it?
2 years. I've been here
Last
just
year?
about 2 years now. And we've seen some changes, of course, in this agency in that time. New legislation has come down. We're now looking after cannabis smoke, which has been rolled
Oh,
into the
sure.
Smoke-Free Ontario Act,
Okay.
so that wherever you can't smoke a cigarette,
Right.
you cannot smoke cannabis either. And our
Right.
tobacco enforcement people are out there enforcing that regulation.
So when tobacco enforcement do their job, are they going kind of undercover, or how does that work?
They don't go undercover, because
Okay.
most of it is, we see you smoking
Okay.
either cigarettes in a
Park
public
bench or
area,
something,
and
yeah.
we just walk up and say, please don't smoke here. And we use a
Right.
progressive enforcement model, so
Okay.
that usually we give people a warning and we remind them
Okay.
that this is what the rule is. But if people are caught repetitively, then there are fines possible. There is a bit of an undercover operation that we run, where
Okay.
we send underage students
sure.
in
Okay.
to try and buy cigarettes. And so
Okay.
it's not legal, as you saw
Right.
in the quiz thing,
Yeah.
to sell to minors under the age of 19. So we
right.
send young people in. If they're successful in buying cigarettes, then our officer goes in afterwards to say, oops, you sold to this
Yeah.
person. And often, again, it's a warning, but if an agency does it repetitively, charges are laid.
Now, do you think that there's any challenges to the Algoma district that may not be seen in other health units in the province?
Certainly, the health of northerners is not as good as that in southern Ontario. There are higher
Okay.
rates of smoking,
Okay.
there are higher rates of alcohol consumption, and there are higher rates of motor vehicle collisions.
Okay.
So all of those contribute to a higher mortality rate,
Okay.
and we're working on trying to improve those behaviors and make ourselves as healthy as those in the south.
Yeah, it has to. The education piece of what Algoma Public Health does is super important, starting in the schools with the young children, going right up into the elderly, into long-term care facilities, for example. So what about the distance between places? Like when we look at some of the mileage that a health inspector or the public health officials nursing would have to take.
I mean, they travel a bit, but we have satellite offices in Blind River, Wawa, and Elliott Lake, and
Okay.
so some of our staff are based out of those offices, and so
Okay.
work in their local community.
Okay.
You talked a bit about health education, and that's an important part, so that the public and the community knows. But as you are aware, if you try and change your behavior, it's hard work to do.
Yeah.
And so the other thing is that we work with agencies, municipalities, to try and create environments that make it easy for you to do the healthy thing.
Okay.
So things like providing healthy menus in our arenas,
Oh, okay.
so that there are healthy choices when
Right.
you go for a snack. creating walking trails and cycling trails
Right.
so that and bike trails so that it makes it easier for people to be physically active. Because if your neighborhood is not safe, you're not going to get out and walk at night. So
Yeah,
a lot of that
right.
policy and advocacy work is where a lot of public health work is happening today.
Right. Now, one more question, if you don't mind. It has to do with what's coming on in the future. Are there any things in the public health arena that people, that yourself, for example, are looking at as some things that we need to be thinking about?
Well, there's lots of things. Obviously,
Okay.
the media has seen a lot of the opioid problem,
Right.
and that we're trying to do some upstream work there.
Okay.
Promoting mental health and trying to prevent addictions. Our inspection team is working on educating people on radon, and it's a silent gas that's in a lot of our homes and
Yes.
can increase your risk of lung cancer.
Wow.
And so that's new to a lot of people in the community. And of course, cannabis, as I mentioned before,
Yes.
is a new risk factor. And even though it's been made legal, doesn't mean that it's safe or healthy. And so we have low-risk guidelines for using cannabis being released.
That you've mentioned many, yeah. And the thing is that public health is something that we all need to be taking very seriously in our lives. Washing our hands. I mean, that is one of the success stories, I think, with public health, is that people are understanding the importance of doing that. Not just the hand gel, but the actually washing
Washing your hands is the most important thing that you can do to prevent infectious diseases. It's very simple and it's very basic, but if we washed our hands and stayed home from work when we were sick, we would have much less illness in the community.
There you go. Well, I really appreciate your time. Thank you so much, and we look forward to the next 50 years of Algoma Public
Thank you.
Health
I
in our
won't be
district.
here for those 50 years, but it's been fun
It
celebrating
will be a different
today.
reporter, too.
Okay.
Thank you.
All right. Thanks.